Hundreds of South Australians are now overdue for elective surgery following cancellations last week to ease hospital overcrowding. The opposition says the strategy has failed miserably, but the government insists the situation would have been far worse if the urgent action wasn't taken.
One of the worst flu seasons on record sparked an emergency response, but despite elective surgery cancellations, our hospitals are still at breaking point.
Clearly, elective surgery cancellations is not enough. We had 2 days of cancellation this week, and in spite of that, our hospitals are more than full.
Our general beds are full, that's true, but we'd have capacity in those specialist beds, such as surgery and so on, where if we needed to, we could put patients.
But now there's a backlog of people needing non-urgent operations. 46 were cancelled between Wednesday and Friday to cope with a significant increase in hospital demand. At the start of July, no one was overdue for elective surgery. Now there are 262.
Tomorrow, at this stage, we expect all of our hospitals to proceed with their elective surgery.
The opposition says the government's strategy was too little, too late, but the Health Minister insists things could have been worse. The government's other new strategy to free up beds is to transfer patients from metro to country hospitals. But the Doctors' Union says in many cases medical staff are simply refusing to do it because it flies in the face of their professional and ethical standards.
There's big concerns about who's going to be responsible. If doctors are put under enormous pressure to move patients and it turns out to be unsafe, who bears responsibility when things go wrong?
He says the crisis should send a strong message to the government that closing the repatriation hospital will only make matters worse. Kim Robertson, 9 News.